Singapore has almost doubled its social spending over the last decade, and most of this went into the healthcare sector as the ageing population here increased, and also into support programs like ComCare and elder care. Let's take a closer look at where all that money went and what it could mean for this year's budget, which is set to be unveiled this Friday. Now, overall social spending rose from $27.6 billion in 2014 to an estimated $52.8 billion last year. The sharpest increase was in 2020, up by nearly $10 billion from the year before, largely due to the COVID-19 pandemic. The healthcare sector took the lion's share over the decade, ballooning from $7 billion in 2014 to nearly $17 billion last year. Outside of the COVID-19 spike in 2020, much of the spending, that went into funding more services and subsidies for the ageing population and paying for capacity like manpower. Healthcare, seen here in green, has in fact replaced education as the largest component of social spending. But that's not to say that investments in teaching and learning are slowing down. The yellow line showing education spending has gone up by $3 billion in the past decade. The difference is that it's shifting away from basic and tertiary education towards continuing education for adults and lifelong learning.
It's about catering to the structural shift of the population away from, for example, a more youthful population where the main driver is really basic and tertiary education. Now we're talking about social services targeted at the middle age to the older population of Singaporeans.
Spending in social and family development has more than doubled as well, to $4.2 billion on the back of more assistance for lower-income families and also as the cost of living spikes. Social spending is expected to keep going up as well, but Professor Tzera doesn't expect a dramatic increase in the next budget. What he's looking for are more ways to help families out of the cycle of poverty and support for people who lose their jobs.
Providing more structural support that kicks in automatically when people lose their jobs and so on to help their families tide over, to help people get re-employed, that's really going to be important. And that could be an area of growth in terms of spending and safety nets. And of course, we're also talking in recent years about how we really want to make sure that Singaporeans from lower resource families are not left behind, that they don't have this cycle of, being stuck in poverty, being entrenched.
To break down this very important issue of social spending for us, we have with us Professor Paulin Straughan on Zoom. She is from the School of Social Sciences, Singapore Management University.
Thank you very much for joining us today,
Thank
Professor
you so much for having me.
Straughan. Most welcome. Now, we earlier heard Don speaking about some staggering numbers on Singapore's social spending in the past decade, nearly doubling, in fact, to more than $52 billion. Now, a great deal of this is for meeting the health and social needs of a rapidly aging population. What is the sense, the dollar sense, as well as the sensibility behind this?
So I think this trend is certainly to be expected as a society matures and develops, and we are in the happy situation where we can continue to support, right, in this area. So we are living longer, so that's good news. But there is a huge gap between health-adjusted life expectancy and life expectancy, about 10 years. So we're not fully leveraging the potential of extended longevity. This explains, the sharp increase in healthcare spending. I think a lot of work ahead of us is on the preventive health front, where we try to level up and prepare ourselves, right, for living longer and learn to take good care of our bodies and our health and preserve our health so that we can close the gap between health-adjusted life expectancy and life expectancy. So that's, I think, a big mandate for Singapore in the years to come. I mean, we are talking about a super aged Singapore, right? By 2030, 1 in 4 of us will be 65 and above. And that's good news. We're not, we are living longer and we're not, expiring, as quickly as our predecessors do. But the next question, of course, for us is, what do we do with this extended life expectancy? We can do a lot if we have good health and we're able to maintain our mobility. So this is where I think most of the money goes into.
Professor Straughan, you know, we do want to live longer, but we also want to live, you know, in a healthy capacity in those extra years, as you put it. But the problem isn't going to go away of a super-age society. So do you see this level of spending, the quantum continuing into the next 10 years? Is it going to be more dramatic? I mean, and especially in the upcoming budget, do you think that this will be reflected in the finance minister's statement on Friday?
I think that, you know, we have done a good job so far, right? We are living longer, and by and large, I think most Singaporeans in the post 50 years are doing well. So that's good news. So in that sense, our base is pretty solid. So this means that moving forward, if we're intelligent and we intervene where it matters, then in short, we spend upstream, right? Looking at pro-health behavior, supporting infrastructure that encourages active aging, for example, and then the new initiatives like ensuring that we're all networked into a GP, a family physician who can help us look after our health and well-being, then I think if we do this right, in time to come, in the next 5 years or so, we should be able to reap rewards. I mean, we are going to live with disabilities, right? The human body will frail. But I think we want to aim for the state where we can live with some disabilities, but it will not hamper our mobility, and we will continue to live productive lives. I think that's the key, right? Thank you.
Let's go to the other end of the scale, perhaps, to the younger people, and specifically helping them marry and have children sooner rather than later. What tops your wish list to incentivize more to have babies earlier?
Well, I've talked about this topic like for most of my career, right? I think that, you know, it remains for me to help young couples, you know, manage, you know, work and family is work-life balance. And I think that we have advanced quite a bit significantly post-COVID. Why? Because we now know that you can work from anywhere and anytime, right? In the past, you know, all this, you know, artificial barriers are put up that, oh, no, you have to do FaceTime, stick in the office all the time and so forth. So COVID taught us that we can work productively. We now have a hybrid work week. So the next step really is to encourage young adults to prioritize and reprioritize their life goals, right? And each stage of their lives to recalibrate what a purposeful, successful life means at age 30, at age 35, at age 40. So we used to think that, you know, oh, you know, when you're young, you have to put your all in your career. You have to make as much money as you can. You have to amass as much as you can so that you can prepare for a rainy day and be a responsible parent. But I think now that you're going to be living till you're 80 and 90, if you live like that when you're 30, I think you will run out of steam, right? So I think it's important for young adults to say, you know, to assess, you know, responsibly what is enough for that particular stage, and to valorize other aspects of living, which includes investment in relationships, right? You know, to date, to find a significant other, enjoy, you know, partnerships. And then when the time comes, you know, start a family. And when you start a family, again, prioritize what you need to invest in family. So all that means that, you know, while money is always important, what is very precious in this kind of dynamic is having that time, that freedom to be able to do what you think is important at this stage of your life, right? So this means that concurrently for employers also need to learn how to recalibrate their expectations. Because if you don't want your workforce to burn out, you don't want your top performers to burn out, give them the time and space to grow and take care of things that are necessary and important in different stages of their life. And then as they move along, you know, as children grow up and they become empty nesters, they will be the most loyal employees you will find in a company. So
Yes,
work-life balance.
Certainly, raising a family a lot of it is about good time management, lots of love and patience as well. Thank you, Professor Paulin Straughan there from the Singapore Management University School of Social Sciences.